Hi everyone, thank you for joining me. I would like to quickly introduce myself. I am Katrina Pruitt. I am in the Honors Program at the University of Connecticut, and I would like to share with you my Honors Conversion project about diabetes in the chemistry lab. So a quick overview of what this presentation will contain is discussing what is diabetes, what is the screening process, and what tests are done to diagnose diabetes, what are good versus concerning levels of blood sugar, how can diabetes be treated, and how can nutrition and lifestyle changes impact diabetes. So to begin the presentation, I want to quickly share one interview I did with someone with type 1 diabetes. In this interview, it will outline everything else we are going to discuss in this presentation.
I was diagnosed with type 1 diabetes when I was 3 years old. I got tested because my family noticed I was extremely thirsty and I had frequent urination. Type 1 diabetes is different from type 2 diabetes as it is mainly a result of genetic factors that cause the condition. Type 2, on the other hand, is usually caused by lifestyle choices and typically occurs later in life. The day I was diagnosed, my doctor took a urine sample and noticed there were large concentrations of sugar. I was then sent to the emergency room where they took my blood and discovered my blood glucose level was over 600. I monitor my blood glucose levels with an insulin pump. This device mimics the way human pancreas works by delivering small doses of insulin to my body every hour. Before meals, I check my blood sugar level and give myself a certain amount of insulin based on the carbs I'm about to eat. I treat my diabetes with a fast-acting type of insulin called Novolog. I also treat my diabetes with a continuous glucose monitoring device called the Dexcom. This device can connect to my phone through Bluetooth where it displays a graph of my glucose levels. It alerts me when my blood glucose levels are high, low, or if they are trending upwards or downwards. This enables me to make decisions about my numbers earlier so that I can prevent those lows and highs from occurring in the first place. I'm able to eat whatever I would like as long as I'm always giving myself insulin right before meals so that my blood sugar levels do not reach high. Something that also helps me maintain my blood glucose levels and overall health is exercising. Because of the ways I've been able to manage my blood glucose levels, I've been able to keep my A1C at a steady 6.8.
So, what is diabetes? Diabetes is a chronic disease associated with abnormally high levels of glucose in the bloodstream. This is known as hyperglycemia. There are two different forms of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes is a genetic condition that is diagnosed at birth or soon after. This is where minimum to no production of insulin is created by the pancreas. And this is different from type 2 because when you have type 2 diabetes, you are born with a normally functioning pancreas. However, you become insulin resistant or have complications with the production of insulin as you age. This can be due to lifestyle habits or things such as being overweight as it's developed later in life due to these factors. So some general symptoms of diabetes is frequent urination, increased thirst, blurred vision, increased hunger, delayed wound healing, increased fatigue, increased risk for infection, or weight loss. And then some long-term complications that can arise from diabetes is heart disease, stroke, blindness, kidney failure, hypertension, and loss of limbs. So now let's talk about the diabetic screening process. This is focused more towards people who have type 2 diabetes because, as I said before, type 1 diabetes, the individual is born with it. So you're more focused on genetics to kind of determine that, and the symptoms are more prevalent at a young age and it's more noticeable. Where type 2 is developed and you may not even know you have type 2 diabetes. So the screening process is extremely important to determine and to catch type 2 diabetes before it's too late and before it's life-threatening. There's actually over 28.9 million adults over the age of 20 that have diabetes in the United States. Of these individuals, 8.1 million are undiagnosed. So here I include a link And it is a quick test to see what your personal risks are for diabetes. And I really urge everyone to check this out. And I did it. It took less than 30 seconds, and it told me all my risk factors. And it's something really good to have, especially in the United States, because so many people are walking around with prediabetes and diabetes and don't even know it. So just quickly, that website is the American Diabetes Association, and they recommend all adults over 45 should be screened or earlier if they are overweight or have at least one of these following risk factors right here. So now we know why we test for diabetes, but how do we test for it? So here you could see the ranges of blood sugar. You could see normal, pre-diabetic, and diabetic levels, and this corresponds to specific tests that are most common to diagnose diabetes. So going a little bit more into that, A1C is probably one of the most common types of tests to diagnose diabetes and to monitor it. Then we have an oral glucose tolerance test, and you can see here there's many different variations. So there's an adult, a child, and a pregnancy test. And for this test, you need to fast before taking it. And then your physician will give you a sugary drink that you will have to drink. And then after a certain amount of hours, depending on what test, they will test your blood to see how your body and how your glucose reacted to that sugary substance. Another kind of test is a fasting plasma glucose test. Again, you do not eat 8 to 12 hours prior to this test, and then they simply draw your blood and see the glucose levels. So, random plasma glucose test, this is very similar to the previous test we just discussed where they just simply test your blood. However, with this one, it's random, so you do not have to fast, and you could take it at any point in the day. With this said, this test is not always accurate to represent your blood glucose levels because it could be different depending on when you take the test. Before bed, early in the morning, before or after a meal, those are all things that are going to affect your blood glucose levels. And then finally, here's a urine glucose test. This was not in the previous slide because it is determined using a pH scale. And this test is actually very relevant to things that we've been discussing in class. It uses pH, it uses a catalyst, and it involves kinetics. So specific parts of the test strip contain different chemical reagents and therefore undergo a chemical change in color when exposed to a large or sufficient amount of a given substance. Proper reading time is crucial for accuracy of this result, so this is relating to the kinetics part. The rate of the reaction is very slow, therefore a catalyst is present. With the catalyst, the strip requires only about 30 seconds to complete the reaction. So therefore you have a very small window and you have to be very precise as to when you read the test strip. If you read the results too soon, it can result in a false negative reading. And if you read it too late, it could be a false positive. So that wouldn't be good. And then finally, this test is a two-step process. So you can see it is represented by these two equations right below. And you can see a catalyst is present during this reaction. And again, this is just another picture showing how the pH is used and it will change the color due to the reaction. And this relates to, again, kinetics, catalyst, and pH that we've discussed in our chemistry course throughout the year. And specifically, Chapter 12 of our textbook, page 655, discusses the chemistry of this test in further detail. So now, how does general glucose analysis done in a chemistry lab? Well, this was a hard question because it's so in-depth. But with Professor Hill's help, she helped me find a lab procedure. It is by Denise Brimham, and it determines the blood glucose by oxidase systems using a color reagent. So this study applies calorimetric techniques to the following aqueous reactions below, right here. This test has been used for 2 years and, in quote, has been found to be most reliable, convenient, trouble-free, and can be computed either manually, so that's like in a lab, or using medical equipment. So just a little bit more about this test. This test used the Beer's law, which we did a lab this year on. And this is just the absorbance, which equals the molar absorbity constant, the length of a sample, and the concentration of a solution. So this lab stated that the molar absorption of the color formed is about 5,100. Therefore, the blood sample used could be 0.1 milliliter. So using all the stuff that they provided in the lab and this equation, we can find the amount of absorbed light is proportional to the solution concentration. And this is crucial in this lab for determining blood glucose levels. Down below here, we have results for the calibration graph. And this is similar to the first slide I showed about testing for glucose. As you could see, the range, the mean, the standard deviation, these are all values that were found in this experiment using the blood glucose per milligram per 100 milliliters, which is equal to the optical density of U and the optical density of S times 150. So this is the equation that they used with the information they found in this experiment. And a quick side note, the optimal density is read at 515 nanometers by using a 10 mm cell. And then here is a YouTube link that goes into further detail of how this lab and how this test is done. It's actually a great video and it shows you an actual lab experiment. So it shows you again how the devices that we've used in class are used in a realistic setting for testing someone's blood glucose levels. So now the treatment of diabetes using medications. Some people manage their diabetes actually simply with diet and exercise alone. However, this is not fitting for everyone. Some people need to include medications into their treatment in order to effectively and safely manage their blood glucose levels. With this said, there are many different types of medications that function differently throughout the body and provide different side effects. Therefore, your doctor may prescribe a combination of different drugs to manage your blood sugar levels. Here are some of the types of medications that are often prescribed. So this first one lowers glucose production in the liver and improves body sensitivity to insulin. This second type helps your body secrete more insulin. The third, a fast-acting drug that produces short-term effects. The fourth type makes the body tissue more sensitive to insulin. The fifth helps reduce blood sugar levels. And the sixth is an injectable medication to slow digestion. And then this last one prevents the kidneys from reabsorbing the sugar into the blood and it causes the sugar to be excreted in the urine instead. So these are all different types of medications that are used, and there's many different variations of these. So it's very important to discuss with your doctor and find the medication regime that is best for you. Another type of treatment that could be alone or paired with the previous medications is insulin therapy. In the past, insulin therapy was treated as a last resort. However, findings are showing how effective it is in lowering blood sugar levels and how great of a resource it could be. So they are urging individuals to try this treatment sooner rather than later. And again, this uses chemical processes. So the chemical process of digestion interferes with the chemical process of insulin. This is all chemistry here. Therefore, insulin must be injected in order to work efficiently. It can't be taken by mouth. Again, there's so many different types of insulin, so it's extremely important to talk to your doctor and not make any decisions on your own. So next, what are some of the necessary lifestyle modifications required to manage diabetes or even just prevent diabetes in general. Regular physical activity and weight loss, if needed, are very important. Another thing that is extremely important in managing or preventing is an appropriate balanced diet. And third, you should always monitor your blood sugars frequently, especially if you are over the age of 45 or if you have any of the risk factors. So specifically, how does nutrition actually play a role in diabetes? Well, it actually plays a huge role. From a nutritionist point of view, there is not one diet that is specific for a diabetic. The diet for a diabetic is very broad and it depends on the person. So the goal of a nutritionist when dealing with a diabetic patient, or working with a diabetic patient, I should say, is to adopt a diet that is realistic for the individual's lifestyle and circumstances. This all needs to be taken into account with their financial means and do they cook? All these type of things factor in because you can't create a diet that they will not go home and actually do, because that will defeat the purpose of everything. This diet should also include well-balanced meals that are proportional and include nutrient-dense food instead of processed foods. And then finally, probably one of the most important things is that meals should be administered at regular times throughout the day. This is known by dietitians as a eating plan. So just quickly, some foods that are great for a diabetic is fatty fish, leafy greens, eggs, chia seeds, nuts, and Greek yogurt. However, these aren't foods that are specifically good for a diabetic. These are foods that are good for everyone. They're simply just heart-healthy foods. So everyone should be eating these type of foods and avoiding processed foods. But specifically for diabetics, these foods right here are specifically bad because they have added amounts of, or processed amounts of carbohydrates and sweetened sugars, added sugars, which are specifically bad for diabetics. So sweetened drinks, white bread, sweetened breakfast cereals, maple syrup, and dried fruits are very bad for a diabetic as it will negatively impact their glucose levels. So counting carbs. You see a lot of people counting their carbs now and trying to be healthy, but counting carbs will become the new norm for a diabetic. Counting carbs is extremely important for someone with diabetes because carbohydrates have the greatest effect on blood sugar levels. This is because carbohydrates are a macronutrient that provides the body with energy. Carbs are composed of long chains of glucose, and once the digestive system digests and metabolizes these carbs, it breaks down the chain, converting it into blood sugar or glucose. This glucose is then absorbed into your bloodstream. So carbs are glucose. So obviously it's going to have the greatest effect on your blood sugar levels. Here you can see 3 different types of carbohydrates, and also the stoichiometry of glucose is a 1 to 2 to 1 ratio of carbon to hydrogen to oxygen. So this slide talks about the overall chemical reaction and breakdown of glucose. Here is a glucose molecule, and here is the overall chemical reaction. This is an exothermic reaction, and it produces energy. So many of the processes that make up our metabolism are chemical-based and non-spontaneous. However, the oxidation of glucose is a spontaneous reaction that releases a large amount of energy. This is what we just talked about in this last chapter of the course. You can see the free energy here is equal to negative 2,880 kilojoules. So this relates to Chapter 5 of thermochemistry and also Chapter 16 that we are just going over now, thermodynamics. However, as I said before, that was the overall equation. The breakdown of glucose is actually very, very complex and has many, many steps. The second step is glycolysis and is represented by this chemical equation right here and is shown through this diagram of how it goes from glucose, goes through the process of glycolysis and produces 2 pyruvate molecules, 2 ADP, and 2 NADH molecules. Following glycolysis, glucose goes through the Krebs cycle or the citric acid cycle, which you could see in this picture here. The net ionic equation for this reaction is seen right here. And this picture is specifically cool. Professor Hill showed it to me, and it shows how your diet directly affects this cycle, depending if you're eating lipids, polysaccharides, proteins, and it shows how they enter into this system at different points and are affecting different things, which was really cool. And then finally, here's another diagram Professor Hill had shown to me, and it pretty much sums up everything we were just talking about and the free energy that is created in this process of the breakdown of glucose and how it relates to ATP, ADP, proteins, amino acids. As you can now gather from the information that has been presented, chemistry is deeply embedded in all aspects of diabetes. It is seen in the digestion process and metabolism. It is seen in the testing process, whether it be utilizing pH levels or through blood tests. It requires the understanding of the Beer's law, kinetics, thermodynamics, catalysts, balanced equations, conversion factors, wavelengths, indicators, and many other chemistry techniques. This is also seen in the chemical process of insulin and the different medications that are used and how it interacts throughout your body. However, it is also important to acknowledge that lifestyle changes and healthy habits are essential to managing this disease. With this said, I want to share my second interview with a type 2 diabetic to close out this presentation.
I was diagnosed with diabetes at about 27, 28 years old. I had excessive thirst in the middle of the night, which is a big factor of determining diabetes. Plus, I have risk factors on both sides of my family, being my father was an adult onset diabetic as well as my mother. How do I monitor my glucose levels? I monitor my glucose levels through a one-touch monitoring system that I have to take my glucose levels before each meal. I am on an insulin pump. Those glucose levels are put into the insulin pump to determine how much insulin that I will take at each meal. How do I treat my diabetes? Within the same way, taking my glucose readings, making sure that I have my pump on, replacing insulin in my pump as needed. And do I have any specific nutritional or lifestyle habits? I've been trying to walk a lot more to be more active because that keeps your glucose levels down. And I do go to an endocrinologist and have my A1C tested on an average of 2 to 3 times a year. And that determines my course of action with how much insulin I take.
Thank you so much for joining me and listening to my presentation. I hope you guys learned a lot, and I hope you guys enjoyed. Thank you so much.